Did you know that adult men who have mumps can actually have infertility? Welcome to All Round Health Talk with your girl, Dr. Onyinye. Remember, this is a channel where we make conscious and intentional decisions to live our healthiest lives. For a very long time, and even up till date, the inability for a woman to get pregnant has been blamed on her. But you and I know that this ideology is flawed. So today, we're going to be talking about male infertility, what can cause it, how to prevent it, and how to treat it. But before we get right to today's very juicy topic, don't forget to hit the subscribe button. Also put on your notifications so you get notified for every time I post a video. Give me thumbs up to show some love and support. Leave a question or a comment in the comment section and I'll get right back to you. And share this video with your friends so that we can all be educated on the things that really matter. Now, infertility in a man is a man's inability to make a fertile woman pregnant after 1 year of unprotected sexual intercourse. A man's fertility depends on two factors. One, having healthy sperm that can actually fertilize an egg. And two, having good ejaculation and erection to help the sperm reach the egg. Which means that even if as a man your erection and your ejaculation is at the top of your game, if your sperm is unhealthy, it will be impossible for you to fertilize an egg or make a woman pregnant. And if you have healthy cells, healthy sperms, but are unable to have good erection and ejaculation, it will also be impossible for you to fertilize an egg. So, now that we know what infertility in men is, what are the risk factors? What increases your chances as a man of suffering from infertility? Number one, any past inflammation of your prostate can increase your chances of infertility because the process of development and storage and growth of the sperm involves the prostate. So anything that affects the prostate can actually increase your chances of infertility. Number two, recurrent sexually transmitted infections like gonorrhea, chlamydia, syphilis can increase your chances of infertility as a man. Number three, early or late puberty. That is, if as a man you started puberty earlier than usual or later than usual, then your chances of infertility increases. Also, injuries to your testicles, such as testicular torsion or even varicocele, can increase your chances of having infertility. Exposure of your genitals to very high temperature. Now, the testicles are within the scrotum. The scrotum maintains a temperature, an adequate temperature for the testicles. The testicles are supposed to be at a temperature that is lower than the body's temperature. So the testicles are maintained at a temperature of 35 degrees Celsius. The body's temperature is 37 degrees Celsius. So anything that will expose your genitals to very high temperature, increasing the temperature within your groin or scrotum above 35 degrees Celsius, can increase your chances of infertility. Also, abusing drugs, using steroids and marijuana, cocaine can increase your chances of infertility. Excessive smoking and excessive drinking affects the health of your sperm and also increases your chances of infertility. Last but not the least, undescended testicles. Generally, when the fetus is being formed, the testicles are formed within the abdomen. Few months before the child is delivered, the testicles descend into the groin area. For some babies, the testicles do not descend until after 6 months of birth, which is absolutely normal. But if, as a man, your testicles did not descend after 6 months of birth, then your chances of infertility also increases. So now that we know what the risk factors of infertility in men are, what actually causes infertility? The causes of infertility can vary. It could be related to genetic factors, like genetic diseases such as cystic fibrosis increases a man's chances or causes a man to be infertile. Also, infections such as mumps, like we've mentioned at the beginning, causes infertility. Sexual reproductive problems, obstruction of genital tracts causes infertility. Hormonal alterations, especially with the male reproductive hormone testosterone, also causes infertility. And last but not the least, erectile dysfunction and premature ejaculation cause infertility in men. What is the actual symptom of infertility in men? There is only one symptom of infertility in men, which is the inability to make a fertile woman pregnant after 1 year of unprotected sexual intercourse. This means that we cannot talk about infertility in a man or a woman before 1 year of unprotected sexual intercourse. So this will be the main symptom of infertility in a man. Obviously, once we are very sure that the woman is completely fertile. Now, if a woman or a man or a partner, a couple, realizes that after 1 year of unprotected sexual intercourse, they are unable to have kids, they must see their doctors. And for a man, what will happen? Your doctor will run some tests like sperm count, blood test, and even testicular biopsy to determine if the infertility is actually from the man or not. And if the infertility is from the man, then the treatment will depend on what is causing that infertility. But the treatment options are IVF, hormonal therapy, or surgery. And how can you as a man prevent infertility? One of the ways to prevent infertility as a man is stop excessive drinking, stop excessive smoking, avoid having multiple sexual partners, take care of your groin area, avoid anything that will expose your groin area to excessive temperature, avoid anything that will cause injuries to your testicles. These are different ways to prevent infertility in men. But what is the essence of today's video? The essence of today's video is for us to broaden our knowledge in terms of infertility, because when we know, we do better. There is no reason why, after watching this video, we should blame infertility on a woman. There are so many women who are dealing with depression, suicidal thoughts, anxiety, from the fact that they are unable to get pregnant because of the pressure that society puts on them. And in some of these cases, it isn't even the women who are infertile, it is the men. There are cultures where women are made to go through a series of tests to determine why they don't have kids, and the men are not even disturbed. They're not even bothered about doing tests on themselves. In this current world that we live in, we have to do better. And when we know, we can actually make changes in our lifestyle, in our relationships, and in our communities. So, infertility can be as a result of a problem with the woman and also as a result of problems with the man. A test must be done to know where the infertility is coming from before treatment can be carried out. There is no need for us to put so much pressure on women when a man can also be infertile. So, I hope that this video has been very educative to you. Remember to share this video with your friends so that we can share this knowledge that we've just gained today with other people. Also, leave a thumbs up for me to show support and to let me know that you like this video, and so that I can make more videos of this types for you. Also, don't forget to leave your questions, doubts, or comment in the comment section. Most importantly, subscribe to this channel and hit that notification button so you get notified for every time I post a video. And just before I go, this is a reminder that my book is still on sale, Surviving Adulthood, which is a book filled with very crucial self-help information that will help you live your healthiest mental life. Don't forget to get your copy. I'll be putting the link on this video and in the description. You can get it on Amazon. You can get the paperback or you can get the digital copy. So get your copy now. I'll see you in the next one. Bye-bye.